Hi, Dr. Garima here again, and today we'll be shooting another video on Australian Dental Council exam, another SBQ. Very nice one. This is actually. I think I've shot a similar one like a few months ago, but in that I have not given out a little bit of more explanation about the clinical tests that are conducted, which I would in this video just to make it a little bit more interesting. And even I learned a little bit more, or rather I brushed up my microbiology knowledge a little bit more while I was just reading through this question and trying to figure out how to make you remember the type of the test done and what does that test indicate basically. So anyways, let's start with the question. A 60-year-old female patient attends your surgery. 60, like pretty old. But 60s is the new 40s nowadays. You don't find looking 60-year-olds like 60-year-olds that they used to. They look like they are 30s or 40s, man. So yeah, a 60-year-old female patient attends your surgery complaining of some soreness affecting her gingiva. She has no accompanying skin lesion. Why that is important? It's a very important sentence because it means that whatever condition, see, usually a lot of conditions that affect the oral mucosa are systemic conditions. They are not just like simple oral conditions, and whenever there are systemic conditions, they are like almost they're accompanied by some sort of skin lesion, which gives you narrowing down of the possibility of what the patient might have. So if the patient is saying that there is no skin lesion, that means you can rule out various other things that are associated with skin lesions. So that is really helpful, like this sentence. The presence and absence of symptoms is equally important in diagnosing. You understand? It's not just the presence of it, the absence of it is also very important. Now, other mucosal surfaces do not appear to be affected. So in the mouth itself, only the gingiva is affected. The cheek, the palate, the floor of the mouth also is not affected. So again, a very important point, which also means that it's not so severe apparently, because in severe most conditions, other mucosal areas in the mouth can also start getting affected. She is medically fit, great, and is not taking any medication. Another very important line, because sometimes some medications induce allergic reactions, or a side effect of these medications can be such type of lesions. So when it says that she is fit and not taking any medicine, that means it's not externally induced, it's coming from within the body, has to do something which is happening in the body itself. So many good sentences have been given to exclude so many other possible diagnoses, okay? So always, like I've mentioned before, I really love long scenarios because they give you so much information that you can just hit on the actual diagnosis. I really hate the one-line questions because then the options can be varied, you know. It's like me asking you, what do you like? Well, you can like thousands of things now, but if I ask you very specifically, elaborating my question, like which specific color you like, instantly a thing will come in your head, right? So a specific elaborative questions are always so in my clinical practice also, I really like patients who like to elaborate a lot on their symptoms. It eases my task of asking them questions because they themselves give out so much information that I'm just left with one or two questions to ask them just to hit the possible diagnosis. Because when they are explaining their symptoms, I'm already filtering out the diagnosis. You know, my brain is working already. Okay, this is not there, probably this is there. And then the patient becomes very happy when at the end of their summary, I just ask them one or two questions and they're like, yes, doctor, this is what it is. I'm like, yes, thank you so much. So, yeah. Okay. So, your differential diagnosis is between, okay, so on intraoral examination, desquamative gingivitis has been observed. Okay, so you already are like pretty much that there is a lesion and it's like exfoliating kind of a thing. So, desquamative gingivitis is a very broad term. It's like me telling you where something in A yellow color. Okay, now yellow has various shades. It can be mustard yellow, lemon yellow, that dark pastel yellow, or very light creamy yellow, you know. So similarly, desquamative gingivitis is a very broad term. Many conditions can exhibit symptoms of desquamative gingivitis. So you need to know which condition is that, okay? Your differential diagnosis is between lichen planus and mucous membrane pemphigoid. Fantastic. So the question has further helped you, and there can be many conditions which can cause desquamative gingivitis, but the question is already telling you that you have already thought that it can be either two of it. It can be either lichen planus or mucous membrane pemphigoid. Now you decided to carry out an incisional biopsy and send it to the lab. Now you need to test. It's like me giving you powdered salt and powdered sugar and just keeping it in front of you. Both are white in color. Now you need to decide which is salt and sweet. So you need to perform a test, right? What you will do in such a scenario, you will taste it. But in this scenario, how are you going to decide it? You're going to take a sample and send it to the lab, correct? Now you need to ask the lab to do a test. Now what are you going to ask the lab to do it? So let's come down to that in the sub questions. So far you have understood the question, right? This is how your brain should operate when you are solving the question in the exam. So your brain will start operating like this a lot when you are a practiced clinician, or you are practicing such mocks again and again and reading through various books, because all the knowledge is processed information you gathered while you were studying your bachelor's and master's, and other information through your clinical practice. And if you're a freshly passed out graduate, then you got work to do and you have to read more and more to gather more and more information, okay? So be patient, it's going to come, and when it comes, your brain will process. You have to just train it to start processing that way. So what are the sub questions? What solution should you use to put the specimen in while sending it to the lab? So you need to know which solution, okay? Because if you just take it and just put it in a box without anything and just send it, wow, it's gonna be destroyed. It's like me parceling an ice cream to you without putting it in an ice container. Ice cream won't reach you in the condition that I sent you, right? Similarly, I want the tissue to be as it is. So always 10% formalin. That's it. No questions asked. I mean, just memorize this, learn this. It's always 10% formalin. Remember your first year BDS anatomy class, those cadavers used to be in formalin fixated, and the bad smell of it. Did you all faint on your first day? I did not, but a lot of girls in my class did. Couldn't stand the smell and the looks of it. So yeah, so 10% formalin, okay. Now what procedure performed on sections of fresh frozen tissue? Okay, what procedure, which test, okay. Do you expect the histopathology department will perform in addition to the conventional staining with hemotoxylin and eosine? Those H&E pencils, they were so expensive, my god, at my time. It was like 50 rupees per pencil, and like we used to hide it like gold. Plus they used to break so often, man. And this size pencil, 50 bucks. Yeah. So anyways, H&E stain would be done, but which other test would help you to determine? Now this question, I have found a very good video which I'm going to play for your better understanding. I know in microbiology we learned about indirect fluorescence, and PAP staining and PAT staining and the other types of staining. Okay, let me shorten it for you. Anytime an autoimmune disorder is detected, and already the question has mentioned it can be lichen planus or mucous pemphigoid, both of these are autoimmune conditions, you will have to test antigen and antibody. Other forms of stainings are for various other purposes, but direct fluorescence and indirect fluorescence are specifically for antigen and antibody. Now lichen planus and BMMP, that's benign mucous membrane pemphigoid, has one gold standard. The pemphigoid can easily be directly tested by direct immunofluorescence. Lichen planus doesn't work that way. Lichen planus has to be microscopically observed, and the H&E stain is just sufficient for it. So that test would directly rule out whether it's lichen planus or this or not. Now, what is direct immunofluorescence? I am going to show you a presentation, but in very simple terms, I'll tell you. I need to detect if the tissue is having an antibody which is attacking a specific antigen in that particular area, for example, the gingiva, and destroying the entire layers of it. You do understand when an antibody goes and attacks an antigen. So antigen is something which is present in our body, or it is introduced in the form of bacteria or virus. The body wants to fight it off because it takes it as a threat. So when it fights it off, it destroys not only that antigen, it destroys the surrounding tissue also along with it, and then the body starts the healing process. Now, in case of bacteria and virus, the antibodies will be produced in our body and it will go and destroy, and once all of those are destroyed, the body heals back and you're good. But imagine if the body starts taking your own tissue cells as antigens. It will continue to keep on destroying it because there is no end to it. Your body will keep on producing that antigen because that's a normal healthy way. It's just that a part of your body has now misguided its system, and that's why it's called as an autoimmune disorder, and it goes and starts just badgering itself, you know. So so you need to test on that tissue whether your own body is producing that antibody, but it's targeting which antigen, because there are so many antigens. So what is direct fluorescence and indirect fluorescence? Now imagine direct fluorescence as example me handing out a parcel to you directly. So that's direct. I'm just giving the parcel to you. Indirect immunofluorescence is me taking service of a delivery person, giving him the parcel, and he's coming and delivering it to you. Okay, that is the basic difference. Now let's just see this presentation. It's just a small 2 or 3 minutes, but it will help you understand the process of direct and indirect fluorescence better. So, you know, somehow knowing the background of the test helps you in questions and in general makes you a better clinician, you know. So let's just see through this.
Today, I'm going to talk to you about the differences between direct versus indirect immunofluorescence. First, direct immunofluorescence. Direct immunofluorescence uses a single antibody directed against the target of interest. So why direct immunofluorescence is called direct immunofluorescence? Because the primary antibody is directly conjugated to a fluorophore. And what is a fluorophore? Fluorophore is a fluorescent molecule. As shown in this picture here, this is the fluorophore, and this fluorophore is directly conjugated to this primary antibody. And this fluorophore conjugated primary antibody is binding to our protein of interest. So in direct immunofluorescence, fluorophore conjugated primary antibody binds to the protein of interest. This is called direct immunofluorescence. So then, what is indirect immunofluorescence? Indirect immunofluorescence uses two antibodies. As the name suggests, the primary antibody is unconjugated, and fluorophore conjugated secondary antibody is directed against the primary antibody. So why this is indirect immunofluorescence? Because primary antibody is unconjugated and fluorophore conjugated secondary antibody is directed against the primary antibody. As you can see here, this is the primary antibody. This is the protein of interest, and we have here two secondary antibody molecule. These two secondary antibody molecule are conjugated with the fluorophores, and these fluorophore conjugated two secondary antibody molecules are binding to the primary antibody. Okay, and this primary antibody is binding to our protein of interest. Therefore, this is called indirect immunofluorescence, because this fluorophore conjugated secondary antibody are not directly binding to our antigen of interest, rather they are binding to our primary antibody. And in indirect immunofluorescence, multiple fluorophore conjugated secondary antibody can bind to the primary antibody, and that can result in amplification of the signal. Okay, So now the differences between direct and indirect immunofluorescence in points. The first difference is that direct immunofluorescence is a shorter process because it only requires one leveling step, whereas indirect immunofluorescence is a longer process because
So let's go back here now to our question. If you want to know more about the direct and immunodirect fluorescence, it's an interesting topic. Like, actually, microbiology was one of my favorite subjects. You can just pause this video, go ahead, read more, and then come back, or just write it down in your notebook. And after this video, go ahead, read through more about it, and even watch that video. It's a nice video. Like, there are many videos available. That was the shortest one, which a proper explanation. So I went through it. So anyways, after understanding that, the answer is direct immunofluorescence because that's the gold standard for pemphigoid. Now, which medication group is used to treat the most conditions associated with desquamative gingivitis? See, I'll tell you what. Any autoimmune disorder, or not bragging, 99% of autoimmune disorders, okay? 1% can still be something which I don't know of. Steroids is the answer. Steroids are something which will suppress your immunity, and that's when the long term they are horrible. And that's why whenever you want to treat a patient with a long term steroid therapy, you have to adjunct it with antibiotics because they are more prone to infections because they are lowering the body's immunity. But then there is no other option. Your body itself is strongly acting against yourself, so you have to lower the body's immunity in order to survive more, or you have to boost up with many supplements, you know. So yeah, steroids is the answer. The rest of the things are not the answer. Antivirals, antimalarials, beta blockers, calcium channel blockers, no. They all work in various different ways and not on the immunity. Steroids is the one which will lower your own body's immunity, so that's the only thing that you can help with. I know there are many conditions like pemphigus, and there's this lupus erythematosus, SLE, and many different types of autoimmune disorders. All of them, the answer and the treatment is the same, steroids. But you should just know, you know. If the condition is mucous membrane pemphigoid, what is special clinical consideration and concern for this patient? Okay. It's like if you just find the patient is having diabetes, automatically you'll be like, are you okay? Like your other parts of the body, like kidneys and the eyes, because you know for sure that diabetes also tends to damage these areas. And if you are the one to diagnose it through the mouth, then it is your moral duty and responsibility as the doctor to inform the patient that he should get the other areas checked. Similarly with pemphigoid, one of the most commonly affected areas apart from the oral area, as oral area might be the first manifestation that the patient observed, it can be eyes. So you should tell the patient that please go and check with your ophthalmologist if any starting changes have started to happen, because in the start everything can be like, the damage control can be much easier than when actually the symptoms blow out. So attention to possible eye infection is the correct answer. Most cases of oral lichen planus are idiopathic. Yeah, that's the answer. They just happen. Lichen planus is not necessarily the effect of any medication or stress or diabetes or whatever. Most of the cases just happen even when the patient is absolutely healthy and taking a good diet. It's like saying cardiac arrest happening in one of the most fittest people in their 30s and 40s. It just happened, you know. So yeah, the answer is idiopathic out here. So what do you learn from this question, this scenario based question? Write it in your notes. Learn about autoimmune disorders. Learn about desquamative gingivitis and all the conditions that present their symptoms as desquamative gingivitis. Learn about the tests conducted. In fact, go back to this question. Learn about all these tests. Direct and indirect, I already explained you. Learn more about pap staining, PAS staining, immunoperoxidase staining, and other forms of methods to detect various common conditions. You may get 5, 6, 10 patients in your clinical practice if you are, you know, a good practitioner with such patients. Like, they are not like regular patients, but You don't want to miss such cases to diagnose if you are the first person, because it can mean a world of difference to the patient's life if you can diagnose it earlier, and your eyes won't see if your brain doesn't know, right? So how to make the brain know, learn, read more about it, like not only from the Australian Dental Council part of you, but as a clinician in general. See, some point of time you're going to clear all these exams and you will start practicing as a clinician. And when you're practicing as a clinician and when a patient comes to you, you have the power to change many things, which also means that in case you fail to diagnose something which could have helped the patient, you are also changing their recovery timeline. You know, you can be responsible morally, if not ethically, to be a person who could have helped but could not because you didn't read that much. Nobody's going to come and teach you. Books are there. People have devoted their lifetimes in writing those books about various conditions in the hope that people would read and help humanity. That is what the healthcare is about, right? Like the actual core of medical is to go out and help. Money is needed, and money is needed to survive, and you take that as a part of your service, but actually the services that you give are priceless because you're helping treat something, and it's we who choose to quantify it, you know. So you have the power to bring about massive changes in a person's life. Don't abuse that power, like use it very wisely. Devote your time, if you have chosen this field to practice, to bring about a change. Money will come eventually, you know, and at some point of time we'll just have enough. Then it's just on you. If you have been given the opportunity to study, I mean, just feel blessed and respect it. All right, so just leave in the comments how this video was. Did you understand anything? And yeah, it's always nice to hear from you all. Bye bye.